I'm Dr. Alan Flashman. This is the third of three short videos for parents of people with autism on medical cannabis for the treatment of autism. We've reviewed the complexity of the plant and the need for respecting the strains of the plant, and we've reviewed the complexity of autism and the need to try to gain some sort of access to global mental functioning rather than trying to simply shoot at symptoms. And today I'm going to summarize the experience of my clinic in Israel with medical cannabis. My experience is based on the limitations that are imposed by the regulation of medical cannabis in Israel, and I'll approach that as we go along. I've treated about 600 children, and it's impossible in private practice to gain access to organized and detailed research, so I'm going to explain what I do. This is not a prescription for what you should do. It's sharing information, and then parents and hopefully the doctors can figure out what's best for any given person. Overall, it's a very optimistic picture, especially compared to the very limited results that I mentioned previously with any of the medication regimens. When you work with medical cannabis in an organized way, and I'll explain what I mean by organized, it's trial and error, but it can be systematic. I see that we reach about 80% significant improvement, either good or very good improvement, and the side effects are very rare and transient. If you have a child who's sort of barely in control of sphincter, especially urinary sphincter, and there's some regression to incontinence, which is less than 1%, but happened here and there, you stop the cannabis and you get back to where you were before, so there's no harm done. And other than that, we haven't seen side effects. If you're using the wrong strain, then you'll see something that doesn't look good, but you stop it and change it the way that I'll explain as we go along. So in my experience, about of the children who get a positive effect, 5 out of 6 use the oils that are mostly CBD, and 1 out of 6 seems to need the THC more than the CBD. The way I think about it is I think we're dealing with a balance between the CBD and the THC endocannabinoid equivalents, and I think that most of the kids are lacking a CBD equivalent, and some of them are lacking a THC equivalent. What's most impressive is that if the CBD doesn't work, the THC does for those children what the CBD did for others. So that's why I think we're dealing with a ratio and a balance, and not with the THC doing this and the CBD doing that, what I referred to as overfocus in the previous videos. So we'll start with the CBD oils. And in Israel, we don't have pure CBD oil for reasons that nobody can explain. So the oils that I have experience with are oils that are basically 20 to 30% CBD and 1 or 1.5% THC. In other words, you're dealing with an oil that's 20 to 1 CBD to THC. That's my exclusive experience. There will be people listening to this video who have access to full spectrum CBD oil with no THC. I have less experience with that, but it certainly seems like it can be effective. Then you would wonder whether you could add some THC later. We in Israel have experience with the 20 to 1 CBD to THC. The way that I try to go about it systematically is I work only with the morning dose first. I don't see a reason to give inadequate doses more than once a day. So we start with 1 drop. It's about 7 milligrams of CBD and the 20th of that of THC. And it's best to give it under the tongue. Doesn't taste very good. Some autistic people don't care about taste. They can hold it under the tongue forever. 30 seconds is good to get good absorption from the oral mucosa, and most of the kids need to swallow it, in which case the dose will be a little bit higher, because the absorption from the gut is a little less than from the oral mucosa, and it'll be a little bit delayed. From the oral mucosa, it's a couple of minutes, and from the gut, it'll be what it usually is in the gut. It's a half an hour or so. So we start with the first dose, and generally speaking, every 3 or 4 days, you go up from 1 drop to 2 drops to 3 drops until you start to see that you have a good effect on global functioning with the CBD, and you reach an optimal dose of CBD. When you add more, you don't get a better effect, or you even get less of a good effect. Once you have an optimal, let's say 5 drops, it could be half a drop, and it could be 20 drops, somewhere in the middle. It's very hard to predict at this point. Then you add a little bit of THC, and that would be a 5 to 10% THC with a little bit of CBD in it. That's what we have. We don't have pure THC. And you add a little to that and see if it's any better. And if it's better, then you add 1 drop, and every week you add another drop until you get to the right balance of CBD and THC in the morning dose. I think it's best to do the morning dose first to get it right. And once you have the optimal morning dose, then you can add doses further in the day. Now, I must say that some children, for some reason, when you add the CBD, they seem to have their sleep be disturbed. You can use the THC oil if you have it to treat the sleep, or you can simply say, well, maybe we need more doses, and there's sort of a withdrawal from the CBD that makes them not sleep, so you add more doses. So if you have the optimal dose in the morning, then you see how long it works, and you figure out whether you need 2 doses or 3 doses. I would say most kids need 2 or 3 doses a day. A rare child, 1 dose is fine for the whole day, and a rare child needs 4 or 5 doses. It just doesn't hold. I don't have an explanation for it, but there's a lot that we don't have an explanation for. Now, if you see that the CBD is going the wrong way, it makes the kid irritable, then stop the CBD and try to do the reverse with the THC oils, 1 drop and then 2 drops and then 3 drops. When you get to an optimum, then add a little CBD, and when you get to the optimum for the morning, then you go over the day and try to keep a good effect through the day. I have no experience with very high dose CBD. It's because of the strange regulations that go on here in Israel, and not because of anything scientific. But I have the greatest respect for Dr. Bonnie Goldstein in California, and you can look at her videos and learn what she has to say about high dose CBD. I simply can't comment on it from experience. So one thing that's worth remembering is that when you give something to the body has to break it down. And the things that break it down are enzymes in the liver. And there's an equilibrium. The liver is inexperienced with CBD or THC, and as a result, the dose may be more effective. And then the liver upregulates itself and develops more of the enzymes. And then it may look like the dose that you started with is no longer accurate. In my experience, it's not uncommon after 3 to 6 weeks to need to increase the dose 10, 20, 30%. You have to do it empirically. There are plant scientists who prefer to say if the dose is no longer effective, stop it and start over again. I don't see the need for that. I think it's an adjustment in the liver enzymes, but the research is not at all in. Another place where the research is not at all in is on which strains of cannabis are best for which people. We have no idea. If you watch the first 2 videos, you see that there's a lot of darkness in our knowledge about plant and a lot of darkness in our knowledge about autism. Put the 2 together, you get more darkness. So if you've been trying a CBD strain and it doesn't work, you tried THC and that didn't seem to do it, go back to CBD and compare strains. And the more strains, the better. My guess is that the 80% that we have as a result is probably because we have in Israel an extraordinary restriction on the flexibility of going from a strain to another. If you're in a more enlightened environment, and especially if you're in a legalized environment, then feel free to try different strains, talk to parents, look into forums. It's entirely possible that the first CBD strain you used just wasn't right for reasons that we don't know, and the next one may be just right, or maybe the third. So it's important to continue to look at different strains until you find one that suits yourself or your child. And my way of thinking about cannabis is that if the child is on one of the antipsychotic medications like risperidol, or one of the drugs for attention like Ritalin, I don't usually favor changing the medication until I'm sure that I have a good optimal cannabis effect, a happier camper. There is no real interaction between the medications and the cannabis effect. You should be able to get a good cannabis effect, and then with your doctor, slowly, autistic people tend to have sensitive nervous systems, very slowly reduce the medication. A great number of my clients have been able to stop taking medication completely and have a much better effect just with cannabis. Some still need a little bit of Ritalin. A rare one needs a little bit more of risperidol. But as I say, we have very little flexibility of strains. Maybe we could do better. But I don't favor stopping medication and then starting cannabis. There's no physiological reason to do that. And stopping medication is a rough ride for a lot of autistic people. And then you'll see the rough ride of that superimposed on starting cannabis, and you won't know where you're holding. You have two different things going on at once. So I tend to wait till I have a good effect, and then I consider reducing medication. So I hope that these 3 videos have given you the information that you need, not a lot of extra information that you don't need, to begin to see that, to my estimation, every child with autism deserves a trial of cannabis. I think that they deserve a trial of cannabis way before they start with medication. It's much more effective and much less harmful. And I don't see any reason to limit when to start. I've started cannabis with children under the age of 3 and seen a good effect. What we would like to do is to see a different developmental track. In other words, if we were imagining that the brain is communicating better with itself, development should be more robust, and we would like to see that take place as early as possible. That's my personal opinion. And the one thing we don't know is, if you get a developmental track that's more favorable, can you stop the cannabis? I would hope so. Anything that you take, it's better if it does its work, and then over developmental time, say 2 or 3 years, maybe more, becomes unnecessary. But none of that information is in. Good luck, and I hope that you're able to make use of this and to get a reduction in suffering. That's what medicine is about.